got a helicopter coming in. Amazing healthcare at work. So tell me about these calculations. Give me some numbers. The healthcare people out there like, hey, I need some numbers. I need some change here. So what can we tell them about what we're going to show them?
Yeah, I think it's important to get a idea of the return on investment for sure before you start investing in digital transformation. We have a provider. They are basically processing 80,000 referrals annually. So we are looking at close to 7,000 referrals per month.
Welcome to Inside the Bot, the podcast that brings you to the forefront of business automation. Brought to you by OpenBots, the game changer in the world of intelligent automation. Ever wondered how to streamline document processing from months to seconds? Or how to skip those pesky bot licenses? You're in the right place.
Welcome to Inside the Bot. I'm your host, Jason DeZamba. I'm happy you're here. Wanted to take today to get outside of the office and feature Orlando Health. They're doing some amazing things in digital transformation, and they have proven that you can quickly perform at a higher rate. Let me give you some examples. In 2022, they had a net deficit of nearly $423 million operating deficit. Now, they made some changes, big and small, and the net result is in 2023 that they were around 323 million gain. Overall, the swing is in millions. It's about $734 million from black to red. They've shown that in a short time span, they're able to improve their operating performance significantly. They've been using Epic. They did a massive rollout with Epic and they trained all their staff. Their goal was they wanted to streamline patient data. So they wanted to have all of the patient records in one place that could be shared within facilities even outside of Orlando Health. And that's a key feature of this update, is that they're able to exchange information outside to other clinicians that are not even in Orlando Health facilities. Orlando Health is taking on digital transformation so successfully that they've won 3 top-ranking awards. The one I'd like to pay attention to today is the Stage 7 organization. And this is a award that's given by HIMSS, and it denotes the fact that they are adopting EMR or health record technology at a rapid rate with the result of having better patient outcomes. So they're putting technology into the hands of their employees and their staff, and the results of the patients are showing clearly. All right, ladies and gentlemen, thank you for joining us today. We wanted to bring Reno here from our team. He is a healthcare transformation data expert, and want to give you some practical ways that we're making transformation possible with Faxes, specifically on the intake side and referral.
The team is spending on an average 5 minutes per referral. So we are looking at almost 3,500 minutes, which is close to 600 hours. So it's not just about the headcount savings, but if you think from a granular level, we are also helping them give back 600 hours back to their business, which can be easily reallocated to enhance patient care or patient experience. So that's another piece of information that I want to share with leaders who are yet to embark on the digital transformation journey.
600 hours, and as we'll see, this is involving processes that are only connected to one enterprise healthcare EMR system too. So the thought going forward is, what does that look like as an investment? It can be a long-term investment, but it can be done over time, but done practically, pragmatically, but it can be scaled in ways that more robust $1 million digital transformation by overhauling all of your EMRs and training your staff, that it can't really do it this way, but it could be done in parallel, which is something that we'll suggest here.
Yeah, absolutely. And think of this, Jason. You take the cost of one medical administrator, right? This automation, to kick off this automation, like to make it up and running, you are spending 1/3 of that particular medical administrator's cost. So we are looking at around $20,000 to $25,000 to build this particular automation. And then, for audience out here, OpenBots is one of the early adopters in the automation space to have the approach of usage-based pricing. So after building the automation, your pricing entirely depends on the volume of documents you're processing and the bot runtime hours. But the good thing is the bot runtime hours is $1.2 per hour. Compare it with a medical administrator who's taking $20 or $22 per hour. So you can easily understand the savings in that aspect. Healthcare leaders, particularly in the States and in Canada, are, tired of faxes. I mean, every single document they are getting from the patients are coming in the form of faxes, from other providers all across, it's coming in the form of faxes. And, you know, these people have like a very big patients admissions team whose job is to, process this incoming faxes, categorize into various form of documents, whether it's prescriptions, whether it's referrals, and then they have filers, logging the data into the EMRs. And this is a very manual and repetitive job in nature. So what the healthcare leaders after today's demonstration can really take away is how OpenBots can really help them remove this burden of administrative work and make the job a little bit more seamless, so their team members can really work on enhancing patient experience instead of this administrative jobs.
The implementation side to roll this out, it's not taking that much time to implement this, and it can be scaled with different size healthcare facilities, correct?
That is correct, absolutely, and it's not going to take a lot of time. It's not like a age-old application development where it's a one-year-old project, or it's not
Mm.
like implementing a new EMR system, which you have to literally plan from a year to get that implemented. It's like we are looking at around 8 to 10 weeks, depending on the criticalities and complexities of the process. But yeah, just to give you a general idea, it's something between 8 to 10 weeks we're looking at to make this project up and running.
Okay. That's a manageable time frame. And what can you show us some documents? I know that we can show on our document side some key things about that. What's speeding up about the extraction process? Because right now, as you stated, these healthcare facilities, they have an army of patient coordinators, medical professionals that are getting that information out manually from these faxes that are sent over for referrals. But can you show us some documents so that healthcare folks, they will recognize what they see every day?
This is a sample patient intake form that we are looking at. Now, all the healthcare providers are kind of very, very, you know, they can understand this particular form in details because they are kind of looking at this sort of sample forms in numbers every day. And what you see here is, literally some data elements on this particular screen where the patient's admissions team for every provider, they have a job of, let's say, handling thousands of these documents every day, which is coming in the form of faxes, that is then converted into a e-file, and then later on the data is kind of filed into an EMR. But for the initial level, they have medical administrators who is kind of reviewing these faxes, and it's on them to understand these documents, go through these documents, and then grab the data, which is essentially going to help them create a patient's chart. So they have to grab certain data like a patient's first name, patient's last name, patient's insurance, patient's MRN number, go inside the EMR, and then file the particular data and create a patient summary or patient's chart. What this particular document is doing in general, it is basically removing the first step. What I mean by first step is the medical administrator's job of getting those faxes, sorting through the documents, understanding the documents, and then taking the data and putting it into the system. Our system, what you see here, is basically the document processing engine. Now, this document processing engine is capable of, firstly, classifying the document. So what you see here is patient intake form. It can
Mhm.
easily classify what sort of a document it is. So if you had uploaded a claims document here, it could have classified it as a claims form. The second piece of information it is providing is all the data elements it is finding it relevant from the document. You see here it is extracting that. And not only that, it is even selecting the checkboxes. So if it's selected, it's going to select it. If it's unselected, it's going to mention it as unselected. So this is a engine that is kind of handling all the document processing jobs of all the patient related data which these providers are handling on a day in, day out basis.
And this is happening with an upload, correct?
With an upload, absolutely. Even for semi-structured, unstructured data, it is going to, I mean, for documents, it's going to happen at the same possible rate. So it's not like you bring in a handwritten form which our system won't be able to recognize and extract data from it. It will equally do it from a handwritten document as well, but as long as a human can read it. For example, a doctor's
Mhm.
signature, Jason, there are times when a human cannot read it, so we can't even rely on a bot to read it. But yeah, it is doable, and it will take like 2 to 3 minutes to process the document and extract the data out of
What I think we can clarify too, because it might not be immediately obvious the significance of this removal of a step. So this is a document that the person or team of people, they're extracting the patient name, the data, the symptoms, the insurance number, the date of birth, all these kind of things. They're they're basically copy and pasting that, typing it into a system. On that right panel, that's just done automatically, right?
it. Exactly.
So why
Exactly.
does that matter? We need people to understand, why does that matter? That step of being that automatic extraction of these data points, why does that matter? And I know we're going to go into that example, but how does that
Yeah.
help them?
Yeah. So basically, Jason, the critical step about this is, I mean, you have to understand, like in a patient's admissions team, there are three different roles. There are medical administrators whose job is to review these documents. Then there are filers who is responsible for filing this information into the EMRs. And finally, the most important aspect of a patient's admissions team is to book appointments. So what we are doing here with this engine is we are kind of already automating the role of medical administrators who is reviewing these documents. And then if you go to step B, which is filing the information into EMR, that is another process which we are able to do with the help of bots grabbing these data out of it. So that is important because we have seen providers having 10-member patients admissions team can be easily trimmed down to 3 or 4 members if they're using a combination of document processing engine and bots to automate the first 75% of the process.
And I would think too is, aside from trimming down existing staff, that staff can do something else more valuable versus just doing this manual data entry that they probably hate anyway, but it's just it needs to be done because that's the operations part of it. That's how you get people in, get them processed, all that good stuff. How you get patient service, but then they can do other things, right, that are more valuable
Absolutely.
than just verifying data.
Absolutely. And Jason, think of this, like every healthcare provider is looking to find ways to enhance the patient experience, right? So, what if we can reallocate the role of a medical administrator so that he can now spend more time on the phone with the patients, or maybe the filers can spend a little bit more time having verbal interactions with the patients or physical interactions with the patient? That will basically help them enhance patient experience and also help them to do certain intelligent tasks otherwise, because they don't want to spend time just filing data and doing the data entry, which can be easily done by a bot, for example.
And this is just for demonstration, correct? This is a patient coordinator is not necessarily going to be looking at this window. This is just to show that we've extracted the information. These are
Yeah.
things that are going to be happening on the back end,
Back
hopefully
end
as
side of things.
seamlessly as the back end. Okay. I know we're going to go into the workflow, but it's going to be a
Yeah.
combination of document extraction and automation, or what, layman terms,
Right.
RPA bots. So that's
Right.
all happening in the back end. Maybe some thoughts there.
Yeah, absolutely. So, this is just like a demonstration tool for us, which shows you the AI capabilities we have. For example, OpenBots documents, unlike any other OCR engines you see in the market, has the ability to understand the context of the document. What we do here is data contextualization, meaning you can just type in any questions and it will be able to give you the answers to this particular document. But traditional OCR players available in the market is kind of doing a data coordination mapping. So, for example, the moment you have full legal name, it is only going to take Ranadev Banerjee as the data field. But for that, you need to train this sort of documents. But for
Mhm.
OpenBots documents, we are not dependent on any pre-built models or data training. So you can upload as many unstructured documents as you like, because Jason, like in the healthcare space, different providers will have different patient intake data formats. And if you are relying on training those documents, then you are at least going to get this data extracted after weeks, if not months.
Well,
That's the
yeah,
kind of time
that's
to
I wa
market.
yeah, so that's kinda what I wanna highlight in just more layman's terms. Before, not too long ago, these tools, they're trained visually on where locations of data is, And then now because of the tool has an element of GPT and understands language, it can find things where they are, but it doesn't matter where, because it understands the context of language. So why does that matter? Well, it's the speed, right? Because it can do it instantaneously. So that's a thought that we need to make clear here, is that it's the speed. You're not taking months and months and months. This is happening right out of the box, where it's understanding the input that you're giving it.
Right, absolutely, and that's what I mentioned, because for any hospital healthcare providers, Jason, uh, they might have 12, 13 outpatient centers, or they might have 13, 14 clinics, and every doctor, every different specialty might have their own document formats. It takes a lot of time for the traditional OCR engines to understand the document formats and then extract data out of it. So you might be looking at a process of 6 to 8 months before you start feeling as a provider that you are getting the desired accurate data extraction rates. OpenBots Documents does it brilliantly because of the integration with Microsoft GPT-4, and we are kind of doing data contextualization. So you can upload any format of a document. We won't take months. We promise you will take 5 to 6 minutes for the document to be processed, and then you will find the data elements like you are seeing on the screen here.
Great. Well, I think we can transition and putting it together, because this conversation is, our skin in the game is not only just to provide a solution, but to transform the way that the healthcare processes exist today to make them better. So we're going to show a specific example that Rano's put together to show how it all works together. Because it's one thing to say, okay, cool, we've got data extraction, but what does it mean in the context of everyday healthcare operations? Let's go, and I think we're ready to see that here. So what is this? It's a nice looking workflow, but give us a high level of what this is, and we can go down in the details. We don't want to bore the healthcare leaders that need to make decisions, but we do want to give them enough information on how this works and why it can change their healthcare processes.
Yeah, Jason, so if you talk to any healthcare leader about automation these days, one of the first things they will say is they want to implement automation in the pre-visit tasks, like what's happening in intake, what's happening in the referral side, what's happening in prior authorization before the operating procedure is going to take place. What you're looking at here is a patient intake and referral process automation. So this is particularly for one of the cardiology service providers, where we have implemented this automation that helped them to trim down their 10-member patients admissions team to 4 members. And I'll explain you how they have been able to do that. But what you see here is faxes coming on top in the form of like e-files. You can see there is a fax folder. What we said to this particular provider is, we are going to have the starting point of the bot as a fax folder where you have all the faxes coming in, particularly the referral documents. Now, what you see here, Jason, on the screen is the faxes coming in. The bot is picking up those faxes, which are in the form of attachments, and then it is pushing it towards our OpenBots documents engine. Now, OpenBots documents is already having an identity to extract 5 or 6 elements, like a patient first name, patient second name, MRN number, a referring doctor, and XYZ elements. After the data has been extracted, what you see here on the screen is the work of bot 2. So bot 2 is picking up those 5, 6, 7 data elements, going inside an EMR, which is Cerebrum in this case, creating the patient's chart. And after creating the patient's chart, it is also attaching the similar facts that came in for any other administrator to review it. And finally, it is also creating the appointment shell. So all this particular provider had to do was have a 3-member team whose job was just to book appointments, instead of going to the faxes, taking the data out of it, going inside the EMR and filing it. So we made sure that this patient's admissions team is focusing on creating more appointments, because we have made everything possible for a successful booking appointment team.
In the ranges that you said to implement something like this, would this be true for this particular process? You said 8 to 10 weeks, depending on if there's less or more complexity?
I think that sounds good to me because what we are doing here, Jason, is we are interacting with one EMR and that's one system, and there would be like, let's say, 10, 12 steps involved. This would take something like 8 to 10 to 12 weeks. If you're interacting with multiple systems, it might take a little bit more, but we cannot cross the threshold of 13 to 14 weeks based on the experience.
Hmm. And why do we need two bots for this? Can you help explain those? And the bots are just, these are just automations that are doing some type of manual work that a human is doing today. But why do we need two of them?
That's a fantastic question. So if you think it from a provider's perspective, so bots are nothing other than, digital workers, right? If you look at bot one, that's the job of the medical administrators whose job is to review the faxes. So all bot one is doing is, just trying to take those faxes from the fax folder and push it towards OpenBots documents. If you look at bot two, that's the job of filers in a patient's admissions team, whose job is to grab the data from the faxes, go inside the EMR and create the patient's chart. Similarly, what bot 2 is doing is emulating the work of a medical filer who is responsible for creating the patient's chart inside the EMR. So that's why we have two bots working in tandem.
The person there, the validation person, if you could paint the picture of their experience when this is running, because it seems like if their role is not jumping back and forth, but they're validating this information,
Yeah,
not finding out where it is in an email, if locating it within the document, extracting it, then being the person to input it in the EMR, then verifying it in the EMR. They've jumped already to the end of that, and they're just verifying and validating it. So what is the mentality of those kind of workers at scale? I'm sure they are pleased with this result because their work just got a lot easier and more accurate.
absolutely. I think it makes sense. So let me tell you this: if they had to spend 2 to 3 minutes per document in a current day, then they are spending, let's say, 15 seconds per document, because all they're doing is just looking at the document and understanding whether the data has been extracted in the right way. Now, absolutely, like you said, nobody wants to, open this particular documents, match two documents side by side, take the data from one place, put it to the other place. So this particular entire step is eradicated completely. What currently they are doing is exactly understanding whether the document has extracted all the data fields. Now think of this, Jason. This particular step, the validation step that you touched on, it's not a mandatory step, it's an optional step. For files that are coming in the format of, let's say, a digital file, you might not need to validate it because our system is capable of, extracting 100% of the data fields that you see on the document. But think about the exceptional cases or the cases where you have handwritten documents. We know healthcare data is sensitive and accuracy is super important. So for handwritten data, we have tried to keep this option in case our bot fumbles and falters to extract data from handwritten text, which is still very much possible for any OCR engine.
So there's always going to, for the majority of this right now, healthcare, especially because it's sensitive patient data. We are saying that there's an option of having a human as a person to validate when it's handwritten. But from this example, this is one of our clients too. And do they any feedback on that when it's on the front lines? I mean, do they given feedback about, well, we human validate, we only need to do it 2% of the time, 5%? Is there any kind of even feedback of what the expectation could be about when we need a human to step in and assist?
Yeah, absolutely. I think that's a good question. So the feedback that we have received is, for some sort of handwritten documents, they are kind of requiring a validation, but for the digital formats of files, they don't need a validation. And the broader feedback that I received, which is great, like, so this particular client of ours, they are processing 80,000 referrals annually. So we are looking at close to 7,000 referrals per month, and per referral might have 3 to 5 pages. So they were initially taking at least 5 minutes to process this entire piece from A to Z. Now if you look at 5 minutes for 7,000 referrals, like 5 minutes per referral document, you're looking at close to 600 hours. So the feedback we have got is we are able to give back 600 hours back to their business. And that's a huge time saving, because like we said, it's not just about trimming down their patients admissions team from 9 member to 4 member and helping them with cost savings. It's also giving them 600 hours back to their business, which they can use otherwise. Like they can easily work on tasks that can enhance the patient care and patient experience. So that's kind of the feedback we have received from this particular provider and client of
It,
ours.
600 hours. I mean, that's amazing. And so you said this is for, as you mentioned, you could see here is this Cerebrum EMR. So what happens? And we want people to be thinking, what happens when you're dealing with 10 EMRs and you do this across the board? How many
Yeah.
hours? How many hours are saved at that point?
Absolutely. And Jason, we are only talking about referrals. These providers have faxes which are then categorized into not just referrals, but prescriptions, but lab reports. So, it's not just referrals. Referrals is just, one of the 15, 20 different format of documents they're receiving. So think about the pain points they have in the other set of documents as well.
And those prescriptions too. I mean, those are being sent out via faxes as well. A lot of the time.
Absolutely. Absolutely. So when the faxes come in, so one other important thing that I wanted to touch on, Jason, what you see here is the process starting with referral documents, but then there are times where we have worked with providers. So we have recently started working with a gastroenterology provider from Florida, and they have been, receiving faxes where they don't even know how much time they're spending on classifying it, whether that fax is a prescription, whether that fax is a lab report, or whether that fax is a referral document. And they like have 5 to 7 dedicated people whose job is to understand what sort of a document format it is, then accordingly put it in separate folders. So for us, we tried to give them a similar solution, but we tried to go back a bit. Like we tried to take a step back and tell them, once these faxes are coming in, we will have bots which will be able to understand the context of the documents and then classify those faxes either as prescriptions or referrals or lab reports. So you don't need to spend 5 to 6 people who is just sorting through these documents and classifying it in the current moment.
Yeah, it's becoming clear, and I personally I didn't realize what a huge issue just under the classifying what the document is. I mean, that's a big issue.
Exactly.
It seems like something to take for granted. If you open an email, you could say, okay, yeah, this is a referral. But there's a lot of time wasted just getting to that step and getting it done correctly. So I mean, that's kind of an amazing opportunity there, and it's not a rollout that takes 12 months to do either. To this,
Exactly.
document categorization.
Exactly. And this is the process which I personally think providers should, look at ready-made solutions available when they are scaling. For example, if you look at this physical therapy clinics, if you look at the dermatology clinics, today they might have 7 locations. You see, next year they have easily scaled it up to 12 locations. Now, processes like this is getting performed at every individual location. What if you
Mm.
can have bots doing this process for the next 5 clinics instead of hiring 5 people, training them, spending not just time, but it's also a monetary investment. And then gradually it also drags the process furthermore. Than you can easily automate certain processes like this instead of doing it in the age-old fashion, I would say.
Hmm. Yeah, the tried and true ways, because there's the processes right now, they work without
Yes,
this, right? They work, they're
absolutely.
clunky, it's manual, we get it, they get it done. It's just it's not very fast, it's not very efficient, and for the workers themselves, they can lean a bird out because it's not enjoyable work. They get
That's
trained,
correct.
they train
That's correct.
to for a better patient experience, to help people, to be with patients, to have a feel fulfilled in their roles, and in not to get too philosophical, but being able to take some of this unfulfilling work off the table and
Yeah.
let the technology handle it. That could be a great incentive for attracting more key players to your healthcare facility.
Absolutely. And think of this, Jason, for this particular providers we are speaking about. What if they spend their time on booking appointments, which still has to be done in the world of automation and AI by a physical user? What if they spend their time on booking more appointments? That brings more revenue to that particular provider's house. Instead of spending time on manually going through these faxes, these referrals, and then putting the data in the EMR, they can spend time on booking more appointments. And that's the main objective of the automation that you see on the screen here. We are, creating the appointment shell right from the faxes coming in. We're basically automating all the steps and then giving back this particular patient's admissions team the appointment shell in which they can, validate the patient and book more appointments instead of doing all the preset of tasks which they had to do.
I like that appointment shell. Well,
Yeah.
I think a good closing point for us would be, I'm trying to put myself in the mindset of a healthcare facility or provider that doesn't have anything like this yet, but they're curious. So how do you get to the point? Because this might, okay, great. Everyone has referrals and all that, but how do they get to the point understanding what they need right out of the gate? If they do have faxes, where do they look? Like what kind of ideas can you give them as a starting point so they can wrap their head around this thing? Create some expectations there on how to proceed.
Okay. Yeah, I think it's important to understand that with the advantages of having this kind of technologies, right? I mean, all the healthcare providers have already leaned towards digital transformation from last year, and with GPT coming into play, we have seen that there's some board level pressure, right, to optimize efficiencies using AI solutions. But on the other side of things, healthcare providers should start small, should look at smaller success and went towards digital transformation, should look at low hanging fruits instead of jumping to a very big process and planning a 6-month process of transformation. So if they can start small, if they can look at the operations aspects, if they can look at the patient's admissions team and get smaller wins like automating a intake process, automating a referral process, because all these particular healthcare providers are receiving faxes and then they have an EMR. So it's just the same thing that we're doing for other providers out there available in the market. But to embark this digital transformation journey, they need to start somewhere. So all I can share my idea on is maybe they start small, maybe they start with a little bit of a process in operations or patients admissions from where they get a little bit of success. That will build confidence and that will help them scale this digital transformation initiatives across the organizational level.
Yeah, I love it. And for those listening that are in healthcare, if you have ideas, if you don't know where to start, I recommend reaching out to Rano on LinkedIn, because it's one thing to have ideas in your mind, but you just kind of get it down on, digital pen and paper and workshop it. And that's one thing that clearly you can understand that Rano and his team, healthcare, they're really good at getting it out there and understanding where to begin, where that low-hanging fruit is. Taking on a big implementation like an Epic and training the staff, it takes time, energy, resources, and it is a worthy goal that all healthcare facilities are in the process of making a top priority. But what can you do now? Well, as we've shown, fax data, fax information from patient intake and referrals is still there. It's still a lot of data that is being handled manually by your key personnel. So have the idea of working in parallel. Look at your short-term strategy by cleaning up this data so it can get into any system of record that you need, whether it's Epic or Athena. And then also in parallel, working on those long-term strategies that are training your staff and implementing new software around the board to integrate that data. I hope you got a lot out from this episode today and wishing you the best in healthcare transformation.